So in the hospital, the social worker may take a variety of roles. They may be a psych liaison that may do an assessment. They may be a substance abuse specialist who may work at doing a brief intervention. Or they may be a case manager who coordinates care while they're there and transitioning them into wherever they're transferring to. In this case, for simplicity and for coordination of care, we made the social worker all three roles. For reimbursement for services, oftentimes, I mean, Elvis can pay out of pocket, but oftentimes for other patients that may not be an option. So they may look either using private insurance, Medicare, or Medi-Cal. Medicare probably for acute care in the hospital, and Medi-Cal probably for outpatient services. And I'm going to hand it off to Megan. I'll shake that.
Okay, so I'm going to talk a little bit about assessment. One thing that's important to remember is that assessment is ongoing. So, and it would be conducted at each different treatment setting. So basically, after assessment, we want to have a complete picture of the client, as complete a picture as possible. So during the interview, we would want to do a biopsychosocial assessment, and hopefully from that we would be able to gain information on, past employment, past education, family history, medical history, any traumatic events that the client may have experienced. We'd want to also delve into current and past symptoms regarding substance abuse. What substances is he using now? What has he used in the past? What's the frequency of use, duration of use? What happens before he uses? What happens after he uses? So what are some of the negative consequences that are resulting from his use and abuse of these substances, as well as any relationships that also might be affected because of his use? So we also want to discover why now, like what is it that prompted the client to come in now as opposed to before. So in addition to the biopsychosocial assessment, we also have some standardized assessments that we could use as well. The drug abuse screening test 10, which we'll pull up and just give you a look at possibly. Okay, and if it doesn't come up, that's okay too. But these are just examples of standardized assessments that we could use to just get a better perspective of his use and if he does in fact have an abuse problem. So that's an example of what the assessment would look like. So just answering a couple of questions. They're relatively short, pretty easy for him to be able to fill out during an assessment session. Okay, so in addition to, well, as part of the assessment process, we also want to assess his current safety. Okay, that's really important. We want to know of any suicidal ideation he may be having, homicidal ideation he might be having. Is he experienced any audio hallucinations, visual hallucinations? Is he engaging in any self-harm or self-injury behaviors? What are his social support networks? What are his current stressors? A lot of times this is known as the S's, so you'll see they all kind of start with S. So social support, stressors, substance abuse, his symptoms, what substances are being used, how often, how much, what occurs before, what occurs after. And again, the meaningful relationships and negative consequences that have occurred because of these drug use. And we also want to know, does the client see it as a problem? Does the client have any insight or judgment into the problems that are being caused because of this substance abuse? Does this client also feel that he has a problem with substance abuse? Because, depending on the client, they may or not feel that it's a problem. Okay, so as part of the assessment process, you want to undergo the mental status exam. So you want to, on your client, just, look at their appearance. So for Elvis, it mentioned in the case study, he's slightly overweight. If he's in the hospital, he's probably wearing a hospital gown, probably looking pretty disheveled because he's stopped using the substance. You want to look at his speech, his behavior, his mood, which he probably, in his case, would report as depressed and anxious. Affect, thought content, sensory perception, so that goes back to, does he have any hearing or sight impairments? Is he seeing anything, any hallucinations, visual, auditory hallucinations? You would want to assess his intelligence, his insight and judgment. Does he have any insight into the problems that are being caused by using the substance? Any insight into the fact that this substance has caused a problem for him, as well as his memory. So, remote as well as immediate, we would want to see if they're intact. Okay, so other sources of information that you would want to possibly use in an assessment, and the first thing that you want to do is you need to obtain written consent in order to go to these sources of information. If the client says that you can and signs off that you can share information with them, it'd be useful to get information from the family, friends. In Elvis's case, his bandmates, his manager, as well as his doctors, therapists that he might have seen, and dentists, because according to the case study, a lot of the prescriptions that he was abusing came from different doctors and different dentists. So we want to get them all on the same page so that he's not going to one and getting one and going to another and getting a different one. So we want to make sure everyone's on the same page and see what their insight into his problem is, get information from them. We'd also want to look at previous medical and psychiatric records, as well as EcoMap, genogram, culturegram, just additional resources to get information on his resources and family history, things of that nature. You'd also want to consider in the assessment his lifestyle, especially for our client. His pressure. He obviously has different pressure than maybe most people experience. Job pressure, family pressure. We want to look at his current coping skills that he uses, if they're working for him, and then possibly what other skills that he would benefit from learning. And we would also want to be sensitive to his schedule. He has a touring schedule, he's going and playing different places, so we need to consider that when coming up with a treatment plan. Okay, so some of the best practices when you're assessing a client for substance abuse would be, one, you will want to identify and manage any countertransference issues that you as a therapist might have, as well as any transference issues that the client might have, and address those. You want to screen for alcohol and other drug problems within the biopsychosocial. Discuss drug use within the context of the client's other history, and especially be alert to risk factors. Are there any risk factors, suicidal ideation, homicidal ideation? Those need to be assessed and discussed with the client. And we also want to focus on offering assistance to the client, letting them know that you're there to help them. You want to develop rapport and trust prior to discussing alcohol and other drug issues. Otherwise, the client is more likely to deny and not be truthful about their use. Depending on the client, some clients, might indicate that those questions about alcohol and drugs are off limits and that they don't want to answer them. So in that case, they recommend going back to other questions, because depending on how relevant the drug and alcohol use is, they will come up again, and you'll be able to address them when they come up again. Avoid confrontation and being over controlling, but you do want to be direct and supportive to the